Salam sejahtera Dr. Nashmi. Today our group are going to present our topic, which is exploring the relationship between sleep disorders and academic performance among UPM students. So here is our group member, which is Umeyi, Chusha Novara Shafika, Nura Akila, and Nurin Imanina. So next I will present about the introduction. There is importance of academic performance for students, which is academic performance is a significant milestone in university life, influencing both present and future outcomes, and it denotes student potential and productivity. Next is overview of sleep disorder and their societal impact. Sleep disorder reduce quality of life and increase mortality rates. There are three main categories, which is difficulty falling or staying asleep, such as insomnia, abnormal behavior during sleep, such as rapid eye movement disorder, and excessive daytime sleepiness, which is narcolepsy. Poor sleep is linked to negative outcome, including mental health issues and decreased academic performance. Better sleep quality and regularity lead to higher grades, and there is 25% of academic performance variation is attributed to sleep duration. So for the part objective, this study aims to determine the stress among students at UPM, which is to examine the factor of sleep disorder among UPM students and to explore the effect of sleep disorders on academic performance among UPM students.
Sleep disorder after correction of conditions that disturb the process of sleeping, such as difficult falling asleep, staying asleep, or having restorative sleep. These conditions can significantly limit physical, mental, social, and emotional functioning and threaten the overall health, safety, and quality of life. So, according to the International Classification of Sleep Disorder, ICSD-3, sleep disorder can be grouped into a 7 major category, which is insomnia, sleep-related breathing disorder, central disorder of hypersomnolence, circadian REM sleep wake disorder, parasomnia, sleep-related movement disorder, and other sleep disorders. Next study shows that the high prevalence of sleep disorder among university students in Malaysia. According to the Law Act of 2024, 57.6% of international students in Malaysia have diagnosed with subthreshold to severe clinical insomnia, while 60% experience mild to very severe restless leg syndrome. Another survey revealed that 87.2% of Malaysia, including university students, face sleep issues like difficult sleeping, waking up frequently, and snoring. Lastly, sleep issues are exacerbated by academic demands, irregular schedule, and increased use of electronic devices also have become more prevalent among the university population. These are the issues why sleep disorder become more prevalent among UPM students. Firstly, students in UPM lack of awareness and intervention about sleep disorder. Students often normalize or neglect sleep issue. Untreated disorder leads to serious health risks such as cardiovascular issue and daytime sleepiness. Second, lack of recognition and misconception about sleep disorder. Many students fail to see sleep disorder as a serious issue. They are confident that they can make up for this by sleeping longer during the daytime. Next, to cope with their insomnia, students often rely on short-term fix such as energy drinks, over-counter sleeping pills, or excessive consumption of caffeine. More worrying, the psychological reliance on sleep aid can create a dependency that leads to more anxiety over inability to fall asleep without them. Lastly is cultural practices in Asian countries, which is focused on academic success than personal well-being. This is because they're practicing Confucian values which are strongly associated with student behavior and thoughts that can exert a dual motivation for academic achievement, which include pursuing their interests and their family and society responsibility. Next, I will pass to Farah to discuss on two objectives of our report.
Imagine being a university student surrounded by new experiences and the pressure to succeed. But beneath the surface, many students are struggling with challenges that affect their sleep and overall well-being. Therefore, me, Farah Shafika, will talk about the factors of sleep disorder among UPM students. First, there is academic stress. Students have a lot of work to do and tight deadlines to meet, and they feel like they need to do well. This stress can keep them awake at night, worrying about exam and how they will perform. They might lie awake thinking about all the things they need to study, or even worrying about not meeting their parents' expectation. When students don't get enough sleep, they often do worse in school. It's a cycle where stress leads to poor sleep, which then makes it harder to succeed academically. Mental health is another big issue. Anxiety can make it hard for students to relax and fall asleep. They might feel anxious about their future, relationships, or even just making friends in a new place. Depression can also disrupt their sleep patterns, making them either stay awake at night or sleep too much during the day. This can make it hard for them to attend classes or even participate in activities they enjoy. Adjusting to university life can be overwhelming, with new social pressure as well as expectations. Lifestyle choices also play a role. Many students drink a lot of coffee to stay awake while studying, but too much caffeine can keep them from sleeping well. They might feel like they need to stay focused, but it can end up disrupting their sleep cycles. They often stay up late studying or socializing, which means they don't have a regular sleep schedule. This can make it hard for their bodies to get into a routine, leading to a poor sleep quality. Lastly, their living environment can make things worse. Shared rooms mean dealing with noise from roommates or outside distraction. Street lights and electronic devices can make it hard to create a peaceful place to sleep. Using screen before bed exposes them to blue light, which can disrupt the sleep. This blue light tricks their brain into thinking it is still daytime, making it harder to fall asleep. In conclusion, university students face many challenges that may affect their sleep and well-being. By understanding this issue, we can work towards creating a better environment that helps students develop healthy habits and get the restful sleep they need. Okay, moving on to the next part. Sleep disorder can have a profound impact on academic performance, affecting not only student cognitive ability, but also their mental health and many others. Let's explore all of this issue and why prioritizing sleep is essential for academic success. Firstly, consider the impact on cognitive function. Poor sleep significantly affects a student's ability to focus and retain information. When students don't get enough quality sleep, they often struggle to stay alert during lectures and have difficulty absorbing new material. This can lead to lower grades and a higher risk of academic failure. Research by Munoz 2020 shows that students with sleep issues often have lower GPAs compared to their peers who enjoy better sleep. Moreover, sleep deprivation and mental health are closely linked. Sleep issues can lead to high level of anxiety and stress, which in turn worsen our academic performance. When students are anxious or stressed, they may find it harder to manage their coursework effectively, leading to a vicious cycle where poor sleep worsens anxiety, which further impairs their ability to succeed academically. This cycle not only affects their academic performance, but also their overall well-being. I think that is all from me, and I will pass to the next presenter to explain any other impact. Thank you.
Besides, poor grades can contribute to their academic performance. As students suffer from sleep disorder, they tend to procrastination and time management issues, making it challenging to complete assignment and meet deadlines. Not only that, but sleep disorder also increase the likelihood of oversleeping or skipping classes, further hindering their ability to keep up with coursework and participate in the learning process. These combined factors create a cycle of academic challenges that can be difficult to overcome without addressing the underlying sleep issues. Lastly, chronic fatigue also can contribute to their academic performance. One of the most effective is chronic fatigue, where persistent tiredness diminishes energy level, making it difficult for students to focus on their studies or actively participate in extracurricular activities. This constant exhaustion not only reduces productivity but also affect motivation and engagement in academic tasks. Also, chronic fatigue disrupt cognitive functions like memory retention, critical thinking, and problem solving, which are essential for academic success. Students may find it harder to recall previously learned material or apply their knowledge effectively during exams or classwork. So next, we are moving on to the discussion. So what are the benefits, is the objective achieved, and what suggestion would be? So we conclude that the objective was achieved, which is we examine the factors of sleep disorder among students and get to explore the effect of sleep disorder towards them on academic performance. So, what suggestion can be applied? Which is offering practical tips. By offering practical tips for improving sleep quality, such as maintaining a consistent sleep schedule and reducing screen time before bed, can empower students to take actionable steps towards better rest. Next will be what are the benefits, which is it can raise awareness among students. This program gave them a lot of information about sleep disorder, including talks that can provide students with an explanation of sleep disorder in more depth.
To conclude all this, addressing sleep disorders among university students is vital for enhancing their academic performances and overall well-being. Now, the pressure of university life, they do often lead students to view sleep as a luxury rather than a necessity, which can negatively impact their mental and physical health. Now, raising awareness about the importance of sleep through education initiatives and interactive programs can help students recognize that prioritizing rest is essential not only for improving grades, but also for nurturing their health. Now, engaging students in activities that demonstrate the effects of sleep deprivation on cognitive function can make the topic more relatable and encourage healthier habits. Now, when students understand the profound impact of quality of sleep on their daily lives and academic outcomes, they are more likely to adopt practices that promote better rest. Now, this shifts in mindsets can lead to a healthier, more balanced lifestyle, enabling them to navigate university challenges with greater resilience and success. Ultimately, fostering an environment that values sleep as integral to academic achievement empowers students to take charge in their health, paving the way for improved performances in their studies and beyond.